Good morning, I'm Michelle Krenzler. I'm a psychological therapist at Stockport's Early Intervention Team, which is part of NIHR NHS Foundation Trust. My role involves providing cognitive behavioural therapy and family interventions to individuals who have experienced a first episode of psychosis and those at risk of developing psychosis. I also have a special interest in compassion-focused therapy. So why did I want to do the internship? An important part of my clinical role is keeping up to date with research development in my area of practice. I started to ask myself whether there might be a place for me in research and whether I could combine this with my clinical role. Could it be possible for me to be part of shaping clinical guidelines, and could I help to give patients a voice through research? I try to ensure that I offer patient-centred care and believe that the principles of equality, equity, diversity and inclusion should underpin all healthcare provision. I was keen to learn more about how these principles are applied in research and to develop my understanding of patient and public involvement and co-production, and how to ensure that research is relevant and meaningful for patients and their families. The internship has been challenging at times. The high expectations I had of myself, along with making comparisons to others, made me feel under pressure and could be overwhelming. Feeling out of my comfort zone and unsure what I had to offer meant that I was holding back from networking and seeking potential opportunities. There were a number of factors that supported my progress, the most important of these being supervision. My supervisor supported me to identify my learning needs and to recognise my strengths, as well as offering guidance and encouragement in planning my next steps. I also found peer support extremely valuable to be able to share frustrations and worries and to feel less isolated. I've attended workshops and seminars with ARC-GM, which have included developing a research question, patient and public involvement, and publishing research. I have attended library workshops and completed training on conducting systematic reviews. I've attended the ARC-GM mental health research meeting and have also made contact with researchers within my own trust to discuss opportunities to support current research studies. I have successfully completed a research methods master's module at Salford University, which has helped to refresh my knowledge and skills and given me more confidence to pursue further research opportunities. I have become a research champion within my service, which involves promoting research studies to clinicians and potential participants. I have recently been successful in applying for a position of senior trial therapist for an NIHR-funded research trial of a new therapeutic intervention for young people with paranoia. So next steps include commencing my new role as senior trial therapist. I will also be doing some work with the Young People's Mental Health Research Centre at NIHR, undertaking clinician interviews and supporting data analysis for a research trial of an intervention for young people with unusual sensory experiences. I will continue to promote research within the Early Intervention Service, and future considerations include completing the Associate PI scheme, completing a service evaluation, and considering options for publication. I'd just like to thank my supervisor, Mia Benyon, as well as Ross Atkinson, Penny Lewis, and everyone at ARC-GM for all their valuable support and guidance throughout my internship. Thank you for listening.